from Newmarket. I'm here today to talk to you about some more educational videos. And I think I'm going to talk today about the lip injections. The lip injections are really popular and people love it. And for this, I'm going to talk again about the anatomy and what should be done with the lips. Because over the last few weeks, I was consulted by other injectors who ran into some complications. And for you guys to understand why people are getting complications and why you have to choose the injector and which product you should have, because there is some product that has more like G prime, as we called it, which is a rigid base to the product, so it gives you the ducky look and it's really stiff and doesn't look natural. It is the facial artery and we have two branches. One goes to the lower lip and it's called inferior labial, and the other one goes to the upper lip, is called superior labial. So here one more time, this is the artery, one goes to the lower, one goes to the upper. The problem with those arteries, they are so superficial. So if you stick your needle somewhere where it shouldn't, you're just blocking those arteries. And if you're blocking those arteries, simply speaking, you're just cutting circulation. And if you cut circulation, you're choking your lips, you're causing, permanent damage for it. There is signs also that with your experience as an injector, you will be able to tell if this happens, because some people, they have normal variation with their anatomy. So even if it happens, if you're skilled enough, you will be able to know that there's a danger that's happening. So this is in terms of circulation. The other big problem, I see it when I see others injecting lips, they don't have the eye for where they should stick their products. So like I personally, which is the beauty measures, we like to have the upper lip smaller than the lower lip. So if we look to how our lips are looking, that this is the pink stuff, this is the structure of your lips, and there is something here called vermilion border, and those are the cupid bow, which I love them because they look nice and sexy. So the way I inject is, when I inject with the cannula, I go inside here to create more volume and create more volume here, and then I go with my needle and try to make like as if I'm making nice frame and definition to my lips. But in the overall, at the end of the day, I like the upper lip to be a bit smaller than the lower lip. And I like to give some size, because the size also gives it more of a volume that makes people having a fuller lip. So again, how you do it, which product you do it, do you know the anatomy, do you have the taste of how it should be? This is the question of, and this is the difference between an injector and another injector. So be careful with that, and stay tuned. We have specials for Valentine's Day. We're gonna use the best product ever with the best technique I can do. And if you have any more questions or concern, or you need to have your lips done, please call us at 905-868-8000. You can also send us an email if you have any question. You just have to say in this email, ask the doctor, and I will be able to answer your question through emails or through the Instagram or Facebook. Thank you again for listening, and wait for more educational videos from us.